What's up, you guys? Welcome back to my channel. Today I am going to be having my gallbladder removed, and I'm doing a review on it because this is my first surgery, and I definitely want you guys to know how it went. I'm at Emory University Hospital, if you ever heard of that hospital in the state of Georgia. I am super duper nervous. um, I've been having some issues since the beginning of the year after getting COVID the second time. So it's been pretty rough. My gallbladder was working at 19%. I believe your gallbladder should work between 35 to 65% to be considered normal. And obviously that's not what is going on. How they obtain that information is through a HIDA scan, where you lay down in this machine, and I'll try to post a video at the top corner so you can see how it works. But you basically, the first process is like a 4-hour study or something. I forgot. 2 hours, something like that. But the first part of it is like an hour. Yeah, it's like a 2 hour. So hour, first time they put this stuff in your veins or whatever, some type of liquid or whatever. They radioactive liquid basically through your IV. Then the second part, they do like a CCK through your IV as well. But because they didn't have CCK on or available, because we're running low on that as well in the U.S. They ended up having me drink like 2.5 bottles of Fairlife milk, and the only reason why I had to do that type of milk is because I'm lactose, so I couldn't drink the Ensure that they provided. So had to go that route. So that's how they came about the whole 19% situation with my gallbladder. And thanks to my cousin, she's actually the one that suggested that I get the HIDA scan done, because even though my CT scan and my ultrasound came back normal, my gallbladder was not, it's not functioning correctly. I was overweight, so I don't know if that has anything to do with it. I've eaten a lot of inflammatory foods, basically not taking care of myself like I should, and I'm still pretty young. So the sad part is now I have to let one of my organs go because of me not really taking care of myself. Or it could just be hereditary thing, because my grandma had the same thing. She had a gallbladder issue as well. So yeah, I'm definitely nervous. My husband's here with me. So yeah, he's here with me as well. So he'll be taking care of me after they, get me out of recovery and all that stuff. This is supposed to be an hour procedure. It's called a laparoscopic something, but basically they do a couple of incisions, 1 centimeter incisions in your stomach, top of your belly button, on your sides, and all that stuff. And they're supposed to blow your stomach with air so they can see where they're going and clip some stuff off. So yeah, but hopefully it goes well, and yeah, be back. All right, you guys, so they have put in my you see it's a catheter in my arm. I have like a little thing on my finger. Pretty soon the anesthesiologist and the doctors will be coming in soon to speak to me in regards to who's going to be taking care of what during the procedure. Basically just going over the whole logistics of what's going to happen in the surgery room. So yeah, they put a patch behind my ear for nausea, because I've had nausea every single day since I've been sick for over 4 months now, which I'm tired of. And also they gave me 3 Tylenols, so that'll help for the pain. And then also another pill, I believe that's and then the Tylenol is also to help with inflammation as well. The other pill I think was for nausea as well. So they're making sure that I'm good with my nausea and everything after I come out of the surgery or whatnot. So yeah, like I said, I'm pretty nervous due to the fact this is my first time having a surgery. I've never had surgery. So we're gonna see how it goes. So yeah, hopefully next time I hop back on, I'll let you guys know how it went. Hopefully I'll be able to talk, and if not, then obviously later on I'll make another, put in another clip or whatever of what happened. and how I'm feeling and everything. But anyway, stay tuned. All right, you guys. So, sorry. So I'm back. I probably look a little beat up because I am. I believe the surgery went pretty well. I know they reached out to my husband to inform him of everything that was going on. He said he got like 3 different phone calls from 3 different people telling them that the anesthesia went through really well, and that they'll be sending me back to surgery. And then when the surgery was done, when the surgery was done, they called him back to let him know how everything went and that I'm okay. So first things first, when I started to come back out of it, I could hear my name being called, and I'm just like, okay, like you coming out of a dream. Thing is, no dream, just complete anesthesia, because it's supposed to, I'm not a medical person, I'm just summing it up, but basically it blocks like something that your body does when you do dream at night, if that makes sense. So you're under. So as I was coming out of it, I did have to cough. They did put a tube down in my throat to make sure that the air that they were blowing into my stomach made its way up the tube, just in case I had any air that makes it up to my chest. The tube was there to catch the air and pull it out. I had a cough. Like I said, I had a cough, almost like if you had like chest inflammation, and that kind of inflammation you have when you cough. I don't know if that makes sense. Like almost like you got mucus in your chest. I did have that, and I still have some of it, but not as bad as when I first woke up. Let's see. Very, very sore. Very sore. They made some mistakes. I'm going to show you my belly. Excuse the belly. It is, I am really bloated. My belly is very swollen because of them jabbing or whatever they were doing down there. You can always look up a video on how the procedure is done. I might stick a clip, a small clip right here for you to look at. And then you can go and check that procedure out if you have any questions. So yeah, I'm gonna show you. Ooh, got a little skin crust. I'm gonna show you my stomach. So they made 4 incisions, one in my belly button, one at the top, and then 2 on the right hand side. So I'm going to show you that now. So I have, excuse my peer's belly, but incision right here, incision up here, incision on my side. This is my right side, and incision on the other side of that one that's on my right side. Your gallbladder is located on your right side, up under here, like almost where your breast bone is or whatever, or your rib bone. So it made sense to have those 2 incisions on that side. They use a camera, they use some tools, they use this thing to blow into your stomach so it can move, I guess, maybe blood or something out of the way, so they're able to see where they're going, what needs to be clipped, things of that nature. So as of right now, because my gallbladder has now been removed, my intestines will now be, my liver will now do all the work, basically. Because what your liver does, it processes bile. But what's left over, like out of that, things that need to be extracted, protein and all that stuff, that's your gallbladder that does that job. So now everything has to be done through my liver. So it's really important to make sure that you take care of your liver. I found out being overweight gives you fatty liver, not necessarily being an alcoholic causes that. And that's no disrespect for people who has the addiction. I'm just letting you know what the doctor told me. So if you're not a person that consumes alcohol at all, or little here, little there, like occasionally social wise or whatnot, nothing too out of the way, like too much of alcohol, then it could be a possibility. And then I also learned this too. Sorry to be skipping from one thing to another. I'm trying to remember everything at one time. I also watched a video, and a lot of my research has come from YouTube videos, Googling, and even the doctors I've been speaking to, because I've spoken to so many freaking doctors. It does not make any sense. You can also have fatty liver from taking a lot of pain meds. This is just TMI, so if children are watching, you can step out of the room as I go over some TMI stuff. If you, as a woman, if you have periods and you are having cramps, and for me, my cramps has always been extreme to a point where I will burst into sweat, and I will lean over and curl up in a ball, and I will not move, and then my pain literally knocks me out. I will pass out from the pain. That's how bad it can get. I haven't had that lately, due to the fact I had to change my diet because there's a lot of things I cannot eat, because everything makes me feel like I need to vomit. So a lot of my foods have been no solids at all. Or actually, excuse me, as I started to get a little bit better, I did start to eat more solids, like Ezekiel bread. At first, I could not eat Ezekiel bread, but now I eat it with some natural blueberry spread, and it is delicious with some hemp hearts. OMG, when your taste buds have done, my taste buds have done a 360 due to the fact I cannot eat a lot of things that I used to eat. It's a blessing, but also a curse at the same time, because also with that, I was at 178 pounds, but I dropped to 130 within 4 months because of me constantly being nauseated every single day and not being able to eat the things. Some things, even the smell of it makes me want to vomit. And also, that can cause additional issues when you drop too much weight. So let me get back to where I was at. I know I'm jumping around, but losing weight very, very quickly can damage your gallbladder. I learned that actually from a coworker I was working with, and that happened to a child of theirs, which is really sad because she was preparing for an event and she tried to lose the weight, and then she ended up losing her gallbladder due to losing weight too quickly. And then I also confirmed that with the doctors, which that is true. Number 2, you can lose your gallbladder, or what can affect your gallbladder is birth control. I had no idea. I was on birth control for a good minute to help with the cramps, which still did not do me any justice. I still had really bad cramps. Plus I gained weight. I had a hard time losing weight with birth control, but I had been taking it for years. I mean years, because I thought that, okay, maybe over time it will start helping with the pain. Maybe the pain will start to alleviate itself. No. Oh, how wrong I was. That brings me to problem number 3. Because of me having all the pain, I would have to take Advil, Tylenol, Motrin, whatever I can get my hands on that was over the counter. I would take it. I was on 500 milligram ibuprofen from my doctor, and that was to help with the cramps. But because they were so severe, and I went to go and see another OBGYN doctor, she was like, yeah, I'm up to like 800 milligrams. Hopefully 800 milligrams will do you some justice. Just make sure that you take them as soon as you start to feel a little bit of pain. I'm like, okay. I had no idea that also taking tons of pain pills, especially on empty stomach. There would be sometimes I would have an empty stomach. I hadn't had breakfast or I haven't ate lunch yet, and I was taking these pills on an empty stomach as well. And then sometimes, like when I have, like my first 2 days, I have really bad cramps. So I would either have to take either one a day or 2 a day to help with the pain. And then 4, being overweight. And I mentioned that before, being overweight. It's 178 pounds. I was definitely overweight for my body type. So that didn't make it any better. And basically that's what I was told today, is that when you're overweight, you will not only mess up your gallbladder, but you you will also have fatty liver. And a lot of these issues, like even with the pain pills, like that can cause fatty liver. And I did not know how serious because even the doctor told me it used to be either consuming a lot of alcohol, cirrhosis, things of that nature. But we have now found out that it also comes with, being overweight. People end up developing fatty liver because they're overweight. So the best thing for you to do is make sure that you are not overweight again. So that's definitely going to play a part with how I go forward eating. I feel as though I ate a lot of inflammatory foods as well. I ate things that had sunflower oil. I consumed a lot of soy because of the diet that I'm on. I don't technically really eat meat, like cows, chickens, turkeys, pigs. Like I don't eat that. Fish, I will do fish, and I will do shrimp, which I kind of started fading away from shrimp just because of the consistency. It seems as though people don't take their time anymore with your food, and they don't cook the shrimp. I mean, I like cooking my own shrimp. If I cook my own shrimp, I eat my own shrimp. But if you go to restaurants, they do not cook the shrimp all the way through because they're in a rush to get that food out to the customer. I get it. But you still got to be careful of people's health. Restaurant food started to be a problem for me as well because there's just a lot of inflammatory things. Like my appetite started to decrease. And I'm just like, why is my appetite? And a lot of this, to be honest with you, I had COVID twice. The second time I had it, it was at the beginning of January. And then all of a sudden, towards the end of the month of February, like the middle of the month, February, I started to realize that my appetite was decreasing. Not only my appetite was decreasing, some things were just setting me off. Restaurant food, I did not want to touch restaurant food anymore because it just made me very nauseated. It made me feel like my stomach had a hard time processing that food. And let me remind you, I was one of those people, like even when I was younger, I could eat food and burn it off and not ever get fat. But that's not the case. As you get older, your body starts to make changes. And it's funny because it's not really funny, but it's like, wow, should have been listening. You hear older people say, you better take care of your body. You better make sure you do this. You better make sure you do that. And I'm just like one of those young people like, yeah, okay, I hear you. Anyways, let me go ahead and get dressed and get ready for this party. Or let me go to the mall. I'm about to do this. I'm about to do that. Let me tell you something. The older generation will put you on game. They try to save you a headache. Getting doctor bills is not fun. Seeing multiple doctors is not fun, especially when the doctors tell you that they don't know what's wrong with you and they just pass you on to another doctor. And I'm still considered young, so this has been a very long journey, a very scary and stressful journey for me. And I'm praying that my gallbladder is what's been causing the problem, because the doctor told me that even though I had my gallbladder taken out, it may not fix 100% of the symptoms I've been having. And nausea is one of the biggest symptoms I've been having that has been keeping me from eating certain things. My appetite, I do get hungry, Um, but I'm still getting full quick. I mean, not now that I've had the gallbladder taken away. Like, I haven't really ate anything yet, because they do tell you to stop eating before midnight. Oh, I'm sorry. Yeah, by midnight. Excuse me. And so, we'll see how that goes, because like I said, my appetite started to decrease. I start having these sharp pains in my stomach, sharp pain up under like where your heart sit. But I already had speak to a cardiologist. They said nothing was wrong with my heart. They do see the palpitations I was having, but that was because once again, referring to my weight. You just overweight. You need to get out. You need to exercise more, be active. And to be honest with you, like, for a living, I'm not very active. I'm not active. I'm not somebody who stand on their feet 24/7 a day, walking back and forth, burning calories, They told me that make sure I do not, so I have this cream called Moderna. Some of you have used it or know about it. Walking down the aisle, may have passed it and may wonder what it was for, or, well, you can read it, but, maybe a quick glance, you're like, what is Moderna? Just keep walking. So basically it's supposed to help with like scars. It's supposed to help with stretch marks. I'm sorry, you guys, if this video is long. I just want to give this knowledge to everyone else, because I was looking for videos of people who has gone through the things I've gone through, and everybody is different. Everybody body process sickness differently. So if you're somebody that's experiencing the same symptoms I'm having, this video may help you. It may not help you. That's fine, but I want to give you the symptoms I had, and really the reason why I haven't been putting out videos like this, because I've just been sick. But if you can relate, maybe some of this information can help you. I'm just saying, take it and show it to your doctor or whatever, and just say, hey, I've been having the same symptoms this lady's been having. So, but anyways, so Moderna is used for scars, acne scars, stretch marks, things like that. So one time I had, what was it called? I had something called dermatitis. I ended up catching on my face. That's the reason why I have this mark. Nobody ever told me about Moderna. I could have got rid of this years ago as a kid, but because somebody did not share information with my mom on what to do, I was left with this nice scar that sometimes show up, sometimes don't show up, but it is highly annoying because people think that I have had a butt whipping. No, this is very much permanent, and you will continue to see this unless there's somebody out there that would like to help me get rid of it. Because I've tried Moderna. Moderna said, baby, this scar is too old. Just like that. So it is what it is. So what I'm going to be doing is using the gel on my incisions, which is like 1 centimeter. I don't know, they kind of look a little more than 1 centimeter, but give or take. I'm going to be putting it on there. One time I got poison ivy on my arm and it helped. Poison ivy will leave a scar on your skin. So make sure if you get poison ivy, you put something on there because it will leave a scar. I put Moderna on there. It looks like it never happened. So he told me that my general surgeon told me that I can do that a week after I have the surgery. So today is the 15th, or June 15th. So I have to wait a week from June 15th to start using the Moderna on the scars. Cannot go swimming for the next 2 weeks. And cannot lift anything over 20 pounds for the next 3 weeks, I believe. So, yeah, a lot of fun things. I'm just hoping that the nausea is gone. Right now, I still have my patch they gave me. They gave me nausea medicine as well, just to make sure that I don't vomit when I woke up. So right now it's working. You can use the patch can be used up to up to 72 hours. 72 hours, you need to get rid of it. Wash your hands, because they said if you touch the stuff that's in the patch and rub your eye, it will dilate your eye. You're going to be walking around looking crazy. Even though it's temporary, people are going to be looking at you like, why is her eye dilated? That's if they all in your face. So if you want to wear some shades, that's up to you. I want to go back to the symptoms, though. I want to tell you every symptom I have or have had. Like I said, for the longest I was having this bubble feel, like something was sitting up under my rib where your gallbladder sits, and it was like a bubble feel. Like something was like I don't know, like something was there in the way. And when I would lean to that side, I would get even more nauseated. Or I would get, extremely nauseated. And the bubble feel ended up turning into just sharp, crucial pains on my right hand side. After a while, the top part of my stomach started to have these sharp pains, and the left side of my stomach started to have the sharp pains as well, which I understand that can also have been my big intestines, because that's where your big intestines is located as well. So I don't know, that may have come from the inflammation that I had in my small intestine and my gut. They said I had a lot of inflammation. I had a lot of acid on my stomach. And I can't take Pepsid. Pepsid makes me want to vomit. Pepsid was freaking horrible. They kept prescribing me Pepsid. My gastroenterologist, my PCP, the hospital, everybody wanted to give me Pepsid. Pepsid did not work for me. Nexium was the only pill I can keep down. 20 milligrams. 20 milligrams. That's the only one that I felt like it wasn't making me want to vomit. So I finally was able to get the acid down, but sometimes I would still have the feeling that, some acid. I would continuously burp. The acid had got so bad, even the burps were burning. Like everything was just so off. My blood work came back, and that's when they found out I had the fatty liver situation. A cyst is, from my understanding, a small cyst on the liver is very common. My husband asked, how, if they in there, could they remove the cyst? Well, the cyst is deep down in your liver. So unless you have if you're going to do all that, you might as well have a liver transplant at that point. But they weren't going to touch it. He said 1 centimeter. That's very common in a lot of patients. It does not cause any issues. But like I said, everybody's body works differently. I don't know. Maybe it doesn't bother people, but might be bothering me. I don't know. But anyways, all right, you might hear my dog in the back. He's in his crate right now, as I am trying to recover. Don't need the dogs jumping up on me, because this would be the worst time for them to jump up on me. I had a lot of sharp, small pains going through my small intestine. A lot of gas, a lot of constipation, diarrhea. Bowel movement would be different. 1 minute I could have a good bowel movement. Next day I may not have a bowel movement for 3 days. But I constantly have going backwards and forwards. Constipation, diarrhea, constipation, diarrhea, diarrhea, constipation, constipation, constipation. So potassium will always be low. When your potassium gets really low, you do get even sicker. You get even more nauseated. So I have to make sure that, my husband recommended, once you take one potassium pill once a week, since they keep saying your potassium is low every time they draw blood. I said, yeah, well, one thing I don't want to do is get dependent on medications. I feel as though with medications, it helps one thing and then messes up something else. The chemicals that they put in these pills are not natural for the human body. Because if you ever look at these commercials with these pills, and they have like this whole, if you've taken blah, 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 and you experienced da, 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 call this number, and I'm just like, it's too much. So I would like to go the herbal way, but herbs are expensive. You have to consistently stay on top of it. because of me not feeling too great, I've not been able to go into the stores like that. Excuse me if I keep it hurts so bad to cough. I'm still having that from the anesthesia situation. They gave me some medicine, some pain medicine too. I don't want to take that pain medicine because it's too strong. Any pain meds that are super duper strong, stronger than ibuprofen, I do not want to take because it makes me want to vomit. So I'm going to take what I have here because what they prescribed me was really strong and I do not want it. Let's see. Lost weight. At one point my hair was starting to come out. But I believe that was just from the stress. My body's just taking on a lot of stress. So I was told that it could have been from the stress that I've been experiencing. My body's taking on a lot of stress. COVID already put stress on the body. It already affects the immune system. That brings me to another thing. Because my vitamin D levels were so low, I had to take vitamin D 50,000 units. That was something that my doctor prescribed because I was very deficient in vitamin D. I think it was vitamin D3. When I would take those, I wouldn't get really nauseous, but I would have a little more nausea than what I'm usually used to every single day. My lips became so chapped. It was like somebody being in the desert without water for a while. I was very dehydrated. I was very, very dehydrated because every different bottles of water would make me sick, which was really weird. So I ended up going to distilled. I came from drinking spring water to distilled water, and that's the only water that did not bother me at all. So this is the water that I've been drinking. This is the only freaking water that did not make me sick to my stomach. I have no idea why. I guess because it's distilled, but there's other distilled waters, but this is what worked for me. Smart water. I tried the Pedialyte when my levels were low. Pedialyte helped me out a lot. Gatorade has so much sodium in it, it started to make me nauseated after a while. But Pedialyte did work. Oh, and the Pedialyte popsicles helped with the fever because I did end up having a fever a couple of times, and it broke my fever, and also it hydrated me. It actually did better than the bottles, to be honest. Like I said, everybody's body works differently. It may not work for you, but it worked for me. What else? And I know this is TMI again. I know that my urine was very dark yellow due to me being dehydrated. And how your potassium levels go down can be from vomiting, vomiting, diarrhea, and something else. I had been having a lot of diarrhea, so that could be the reason why my potassium was low again. What else? I'm trying to think of everything, you guys, because if you're experiencing any of this, and I know, like, lately, I don't know why this happens too. Maybe I need to blink my eyes more or something. I don't know. But sometimes now I wake up to really dry eyes. And I'm wondering what, I'm like, my eyelids are stuck to my freaking eyeballs. Like, why am I waking up like this? And I'm freaking out because I'm just like, can I not see anymore? So almost every day it's like something freaking new. And it'll go away and then come back. Go away, come back. And if you are so with the nausea pills, I started to break out in these small little bumps, like hives. You can get sun rashes. I didn't even know. I didn't know you could get a sun rash. I didn't know what a sun rash. The pills that I take, you cannot be exposed to light. So at this point, I've done turned into a vampire. They can't be exposed to the sun. Because I can't be exposed to the sun like that, I gotta make sure I have my vitamin D. So it's just, I like getting out of I like to go and take my dogs for a walk. I like to get out my garden. So what do I do at this point? But after a while, I don't know if it was a small side effect because it happened maybe 3 or 4 times. And then now I'm just fine with the pills. Like I'm just fine. Like my doctor changed up my pills, my nausea pills. And then one day I just didn't have any more nausea pills because she was taking a while to send my other ones over. So I started taking the other ones, and I was just fine. I'm like, what the heck was that about? But they do encourage you to put sunscreen on if you do decide to go outside and to cover up. But who wants to go out in this weather right now? Like here where I live, it's like 104 degrees. Who in the world wants to go out in the sun covered up? Like you're gonna burst into flames. So just kidding about bursting into flames. I don't know, but for me, it feel like I'm about to burst into flames. So I don't know. Like even using the restroom, doing the number 2, like the bottom of my feet like tingles, like almost little statics of electricity going through your feet. I don't know what that's about either. I don't know. It's weird. It's the weirdest thing. All right, everyone. So I decided to move my view. So what was I at? The static part. Yeah, the static part is really really weird. Oh, and if you guys hear any noise in the background, I am outside, as you can tell. So I just needed some fresh air. So that happened. And then like before all this started to take place with me being extremely sick, I had like pain like in my neck area. And then I started to have like this pain like in my shoulder. Sorry, that's the I guess the bandage, the sticky stuff to hold down the the needle or whatever. So you may see that on my skin. I'm gonna tell you about that as well. And then I started having like this pain in my like shoulder area up in here. Look at my face. I know I need to stop picking my face, you guys. I need to see a dermatologist next, but I'm not going to do that until I get really, really better because I would hate to have a mishap in the doctor's office. So I was having like this really bad pain like in my back area, and then sometimes the pain on my side would shoot like to my back or whatever, if that makes sense. I was just having like really weird pain that I've never had before. And then sometimes when I would go long distance, now sometimes you'll have traveler's diarrhea where you travel a lot and may have diarrhea or whatever. I don't know what's the cause of that, but I was having diarrhea and stuff like that after going, traveling places and stuff. What else? Let's see. I'm trying to think. I had small headaches every so often when I would wake up in the morning. Small headaches. My nose became sensitive to certain smells that just made me want to throw up. They did do pregnancy tests that came back negative. Blood work came back good. Besides the liver situation, which now my liver levels is back to normal, actually at a really good level from what they told me last. And they said as long as I keep the weight off, I shouldn't have to worry about that. I don't know if I mentioned that before. They also told me not to bathe the first night, so I'm gonna have a hard time sleeping tonight. I'm probably just gonna wash my face and try to wash my private areas without hitting any stitches. The stitches are liquid, so I guess that's okay. A little nervy, but I think that's like a new method that a lot of these general surgeons use now, the liquid stitches, I guess depending on how severe the surgery is. And so like I said, first night no full bath, second night I can take a full bath. Hopefully I can have some iodine, because iodine is really good about killing bacteria on the skin and all that. Before my surgery they gave me this antiseptic that you wash with. So you wash your body with soap, you use the antiseptic on your body, you pour half of a bottle the first time, and then you use the other half the second time in the morning, but you do not use soap that second time that you do the shower or the bath or however you bathe yourself. or you clean yourself, should I say. You do not put on any deodorant for the surgery. No perfume, no lotion, no smell goods, basically. You do not let your dog sleep in the bed with you or cat sleep in the bed with you, because there's things that's in their fur that can get on you, and then say they open you up. You got bacteria on your skin from your dog. Not saying your animals are nasty or anything like that. That's not what I'm saying. What I'm saying, there's just some microscopical things that they could be carrying on their skin or their fur we may not see, but it's definitely going to be on your skin. So please be careful with that anytime you have surgery. As I know, sometimes we love to sleep with our fur babies, so don't do it. And also make sure you put up your animals too when you come home from surgery, because the last thing you want them to do is get really overexcited, especially having puppies, not knowing no better. My dog, one of my dogs is older, so right now it's like he know there's something wrong, and he's not jumping up or anything. He's just kind of looking back at me like, I smell that there's a wound, and I know that it's probably you, so I'm not gonna jump on you. Now my puppy, I got him in a crate just because he likes to jump on you and greet you, which we've been trying to work on breaking that, because jumping on anyone, and your dog I have a really big dog, it's not a good thing. Especially in this situation. What else? No, I'm gonna take it easy with the eating. He said some people just go back to eating the way they did before and not even notice the difference. I am not trying to test the waters. I have another study coming up. It's called a nuclear medical emptying study, to see how fast my stomach is emptying, because it could also be emptying too slow. The doctor said, I feel like I mentioned this too, but I might be repeating myself. I just want you to it's better to be over-informed than under-informed, if that makes sense. He said that my stomach could be empty and slow, along with the bad gallbladder, which could be the reason of my everyday nausea. So keep the appointment. Make sure you go and see your gastroenterologist for that study. Also, make sure I'm going to see my nutritionist. I don't believe I told her I had a surgery, so the last time I think we spoke, it was just about the things that I should eat. So she told me to eat like hemp heart hemps, you know what I mean. She told me to eat like not whole grain and all stuff. Prior to all this, I wanted to make sure that maybe it wasn't nothing that would set me off in my house or outside. So I did a allergy test. I bought some allergy tests, and I'm probably going to put the links up here, or put the links down in the comments so you can see that those products that I got off of Amazon, they weren't really, for me, it wasn't really that well, one of them I didn't get off of Amazon, because there's a certain thing that they look for that that is in one test but not the other. So the first test was a hair sample, the second test was a blood sample, and we all know sometimes blood can be more efficient than just a piece of hair sample. And when I got my test back, baby, it seemed like I was allergic to everything. So, and that was with the hair test. The blood test was very general. It was, dairy, gluten, just different, I think he said I was allergic to crab, or was that the other? There was some things that it says that that was very high on this grid that they have. It goes from low to high, and a lot of them were under high for me not to consume. If I decided to consume some things that were medium, I could stop those and then implement them back in over time, but not right away, like one by one, just to see if it messes with my stomach or not. So basically she said no dairy, no gluten, no seafood. There's a lot of things she told me to cut out for now. And if I wanted to implement them, it has to be one by one, and not just do something different the other day. No, you need to put that new food in there and try that one food for a week, see how that does. If it works, implement another food, things like that. She hasn't seen me since then, so hopefully, this time she'll have something new for me or whatever. Like I said, she told me to eat hemp hearts. What was it? I can use natural blueberry spread, natural strawberries, and put it on my toast. The Just egg, the company Just, eat their eggs, because eggs was one of those I couldn't eat either. Yeah, those are a couple of things she told me to eat. So yeah, I'm pretty interested in what she's gonna say this time. So yeah, it's been a journey, that's for sure. Anyways, if you all have any questions, I know this video is long. I just wanted to put, this is my personal life, so I'm putting my personal experience out there for you to use. Towards maybe trying to help you find a good doctor where you have any symptoms. Maybe you can use some of the things that I use or had to go through. Because like I said, at first, my second gastroenterologist, my first gastroenterologist I love, she was booked. I was so sick, I said, I gotta see somebody now. So that's the only reason why I left her to go and see somebody else, because I needed an opinion ASAP. So I talked to the second gastroenterologist. He slid me a piece of paper that said next to him, and these pills that's supposed to calm the muscles in your intestine, so your food can move better or whatever. But basically, he diagnosed me with IBS. And I'm like, okay, this cannot just be IBS, because I am feeling horrible and I'm not eating anything that will make me this sick right now. So I went to the hospital. Was like, oh, you have C. diff. Oh, okay. What's that? So I looked that up. What? I took their horrible pills. I said, okay, I'll take these horrible pills. It was so hard to keep them down, because I was already nauseated. Now you're giving me a medication that's going to mess with my stomach even more. Like, how does that work if the person can't keep down the pill? Luckily, I was able to keep them down. So from there, I ended up going to my PCP. She tested me, said you do have C. diff. So from there, I went to an infectious disease, which my gastroenterologist suggested. Why are you here? You do not have C. diff. I mean, he said the same thing, but I guess just to make his point, that's why he sent me. I don't know. I was confused as the doctor that was asking me, why are you here? Because he sent me here. Okay. So I went back. You do not have C. diff. We've done an endoscopy. That's come back negative. You did have one polyp, but it is not cancerous, precancerous. We've done your biopsies. That's all came back negative. We don't know what's wrong with you. We don't know why you're sitting nauseated. We have no idea. We have no idea why you keep dropping weight. Okay. So, and prior to all this, I already had had an ultrasound. Ultrasound came back saying my stomach was fine. This second time I went to the hospital, during this journey, they were like, yeah, you have an inflamed, at the top of your small intestine is inflamed, your gut is inflamed, you have thickening in your lining of your intestine, you have what is it called, gastritis or whatever, and then they said, yeah, well, also, you have a fatty liver and you have a cystic liver. You all types of messed up. Well, yeah, thank you for confirming that I'm pretty messed up right now. I appreciate it. But how are you gonna fix this messed up person? Well, I'm gonna send you home with some medicine, some more Pepsi, and all this good stuff, and then you just go from there. Oh, okay. So, I went to the one that said he didn't know what's wrong. He sent me to a third gastroenterologist. It's supposed to be the best of the best. clinic that he sent me to. I said, okay, we'll see. She says, because of COVID, you have post-infectious IBS. Okay. All right, post-infectious. We're going to do this test and see how fast your stomach is emptying. Okay. Let's do it. Prior to that, like I said, my cousin had suggested I go and have a HIDA scan done. HIDA scan shows that it was operating at 19%. It's the only way I knew about a HIDA scan. Not one time did these doctors ever mention anything about a HIDA scan. Ever. Only one person mentioned it, and that's because she was ordering it for me. Actually two ladies. But it's only because I asked about the HIDA scan. And if it wasn't, like I said, if it wasn't for my cousin, I would have never known what a HIDA scan was. So, yeah. It's been a very scary, stressful ride. Very scary and stressful. Especially for a doctor to look at you bold-faced and just tell you that they don't know what's wrong with you. And for you to be passed along to the next doctor, it becomes very discouraging. It takes your confidence out of these providers that's supposed to provide you with, with, the best care. So your health, your life is in the hands of these people, and I just feel like I'm deteriorating away. Or these professionals, should I say, not these people, these professionals. And nobody can tell me exactly what's wrong with me. All they can say is, don't know what's wrong with you, or maybe it's this. Maybe it's that. It sounds like this, but no, can't be that. Okay. All right. So you have no answer at all. But anyways, it is what it is. Like I said, I'm doing this video basically just to help somebody else out there. I will, if you all are interested in an update on how everything is going, I can definitely let you know. I can definitely let you know what's been the pros and the cons about getting your gallbladder taken out. What I have experienced for myself. I will tell you that I am 5'6" and I weigh 130 pounds right now. So if you have this body type, I suggest try to keep it at a safe weight. Being too low is not good. Being too high is not good. Oh, and the general surgeon says also do not cut out all fatty foods. Like don't cut your fatty food intake too low. You can't be too low. You can't be too high. It has to be in a safe range in the middle. So if you're going to eat fatty foods, make sure that you intake in the correct amount. And you can do more research by Googling. I've done a lot of, let me tell you something, I've done so much Googling that Google, they already know what I'm about to look up. The little things pop up and I'm like, that's what I was thinking. So do your research. And like I said, I'm just doing this to help out somebody that may be going through these issues too. If you're interested on how the HIDA scan went, I can do a video on the HIDA scan when I get there. That's going to be coming up soon. It's going to be coming up next week. So if you'd like to know how the HIDA scan went or how does it look or whatever, I will take you with me and we'll do this thing together, okay? Because that is a 4-hour study. It's a 4-hour study. So get ready for the shenanigans like I got to prepare for it, okay? All right, you guys. So just like that, we out. Peace.